Good afternoon. My name is Mariah Peterson, and I will be presenting on Practicum Nursing 838. So my practicum site and experiences so far. So my location is the same as last term. So I'm still at Heart of Hope, which is in Hayden, Idaho. My preceptors are Matt Palmer and Kimberly McDermott, both who are NPs. And then mainly my experiences are either in urgent care and family practice, as this clinic has both, and depending on the day, each provider will be in urgent care. So experiences so far, I've done or experienced a mole removal, a very, very large wart that had to be shaved down, so that was kind of fun. Some complex cases included a patient with bilateral wounds to his extremities that just would not heal, and all of his labs were normal. And he had been in the Philippines for the past 16 years doing missionary work, and so that was kind of interesting. I had to kind of research different tropical diseases, plus, like vascular disease. Anyways, that was an interesting case. And then there have been multiple pediatric cases, one that was complex, a severely jaundiced 11-month-old, which later found out the next time I came back to clinical, the labs resulted showing hepatitis. So it's interesting because the population I work with, there's quite a few pediatric patients due to the extreme push for vaccines among children, and since the COVID vaccine, and so a lot of these patients have left the pediatric care at the local Coeur d'Alene center and are now seeking out private practices that are not pushing for any vaccines. So that's been kind of interesting to see that shift. So practicum objectives. So far I'm meeting, basically creating a plan of care for at least 8 patients a day, which is the amount of patients I'm seeing, being able to discern when a referral is needed, being able to explain all the pediatric milestones and anticipatory guidance. As stated in the last slide, there is a high pediatric population. Treatment of long COVID, which may be controversial, but includes actually using low-dose naltrexone as a treatment plan, and so it's been really fascinating to kind of learn that treatment protocol and actually see really, really good results neurologically, which has been interesting. And then gaps or things that are in progress regarding my objectives include assessing pregnant patients sent to the clinic. There's a lot of midwives that will refer to this to Heart of Hope. So far there haven't been any. I think there was 1 or 2 maybe last term that came through. And then continuing to transition from the role of the RN to that of the provider, and then evaluating the correct antibiotic for the correct bug, and then a lipoma repair. So plan to meet the gaps. So again, continue to assess any pregnant patients that have not, I just haven't seen any, so just continue to see any that come in. And then while in the role of the RN, I've just been kind of challenging myself to be like, okay, well, if I was the provider, what would be my plan here? And that I think has kind of helped keep me in that mindset of the provider role, but still allows me to obviously be the RN at work. So, and then reviewing data regarding antibiotics and up to date. And then pending lipoma repair, the patient has scheduled it, and then I think he canceled it and then rescheduled, but I haven't seen him come back yet, so my goal is to get that before this term is over. So, and that is all I have. Thank you.